What's different today than it was? I mean, obviously, there's got to be so much different from what you did. But if you were to look at the one thing that really has changed from then to now, what would you say?
Okay, so a lot of the things that have changed is patients' expectations, patients' education, and the type of look that people want. I mean, that's a broad, but you know, the expectations is that patients, when I first started here in Miami, that was in 1988, people wanted to look like they had nose job. They wanted to look like they had their facelift. Because most people at that time, you know, the people that were having plastic surgery was a very expensive proposition. So people wanted to know that you could afford it. To me, when I first came in, I saw this, it used to torture me. I'd go to the Jackie Gleason theater, and
we're dating ourselves now. We both know Jackie Gleason.
Sure. And so I would go watch the show, but I'd see these people, and I just couldn't believe that people actually liked to look that way. And so I recognized that that was not the style of what I was going to do. You know, the education, patients are no longer in the dark. I think they're no longer in the dark in any medical field. You know, I always ask them, okay, what did Dr. Google tell you? So when someone comes in and they start asking me questions, I think one of the things you have to be is really transparent. And if a doctor, I always tell my patients, if a doctor isn't telling you what you want, there's so much choice. But you can look it up on the internet, although the internet has some good and some bad because there's a lot of fraudsters out there on the internet. So the education of the patient, they're more sophisticated in what they want, how they want it. You know, one of the key things that I've always done and I worry about is that patients think they know more than they actually know because now they've read it on the internet, so it's got to be true. So I don't let patients dictate the technique I use. I let them dictate what they ultimately want, but they have to allow freedom for the doctor, whoever doctor you choose, to do it.